Good morning. Thank you so much for joining us today on Facebook Live. I'm Dr. Rachel Miest, Medical Director of Aesthetic Dermatology here at Mayo Clinic in Rochester, Minnesota. Today we are talking about the Rejuvenate Spa and our services offered. We will be taking your questions throughout the broadcast, so make sure to post your questions in the comment section below. Joining me today is Heather Breck, lead esthetician and my assistant at Rejuvenate Spa. As a dermatologist, I am trained to diagnose diseases of the skin, hair, and nails. I have a special interest in women's health, so my interest in aesthetic dermatology came quite naturally as a response to the needs of my patients. As part of my education, I had the opportunity to travel and train with leaders in aesthetic dermatology, both nationally and internationally, and that invaluable experience has allowed me to take what these leaders are doing every day and incorporate them into my own practice for my patients. I do have a diverse medical and aesthetic dermatology practice, but one of the best aspects of what I do is my practice at Rejuvenate Spa. To start today, Heather, our lead esthetician, will tell you a little bit more about herself and also about the services that we're offering.
Hi, my name is Heather Breck. I've been an esthetician with Rejuvenate Spa for the past 3.5 years. I've been fortunate enough to be able to work with Dr. Miest in our aesthetic practice for the past year. At the Rejuvenate Spa, we are a full-service spa. We offer nail services, massage services, and skincare services, along with our aesthetic practice. Our massage services include relaxation and deep tissue massage, bamboo and hot stones, body wraps, and we will be beginning Reiki treatments in December. We also offer full-service nail services, including manicures and pedicures with an express option for those that do not have the time to come in for a full service. We also offer skincare services such as facials, microdermabrasion, chemical peels, and we also have a new service called the Hydrofacial, which we will talk about more later on. We also have the extension of our skincare practice with the aesthetic dermatology department, and Dr. Miest can speak a little bit more about that as well, about what we do in aesthetic dermatology.
All right, so as Heather mentioned, we do have an aesthetic practice. We've been at the spa now for a little over 1.5 years, and it's been just a wonderful, wonderful practice, and we've really enjoyed it. And what we're offering currently are scientifically proven and safe, non-invasive, and minimally invasive aesthetic procedures, including botulinum toxin or Botox injections, soft tissue fillers such as Juvederm products, and medium depth chemical peels. As Heather mentioned, some of our services over at the spa include superficial chemical peels and our new Hydrofacial, which has been a hit with our patients and is something that we love to incorporate as part of our treatment plan. Our clinic over here at Rejuvenate Spa, I begin with a comprehensive consultation. I think that's so important to really evaluate and understand what your goals are and what you are hoping for and hoping to achieve. We always focus on rejuvenation and restoration. We aim for very natural looking results. As I mentioned, as a board-certified dermatologist, am the one performing medium-depth chemical peels, the injectables such as Botox and soft tissue fillers. And we always try our very best, no matter what, to accommodate same-day services when we can, because we know that people are busy, and oftentimes when we see you, it's exciting and we want to help you right away. And so when possible, we do try to make that work. Heather assists me with these procedures and is an incredible resource for our skincare products that we do carry at the spa, and that works very well. We work together in tandem with that consultation, particularly with the skincare recommendations and helping with maintenance regimens and things like that. Additionally, it is worth noting that Mayo Clinic Dermatology has a growing laser practice, and so I do have the ability to perform lasers for redness, brown spots and wrinkles. And so that's been a really nice addition to our current services. Finally, if in our consultation we decide that it might be best for you to consider a more invasive procedure, I do have the ability to facilitate referral to one of my surgical colleagues if that is felt to be the very best for you. So at this point, now that you know a little bit about us, we'd like to open it up for any questions that you might have about anything and everything, whether it's related to Rejuvenate Spa and our services, or specific questions about skincare or some of the procedures that we offer.
I think one of the main questions that we tend to get is whether or not just anybody from the public is allowed to come and make an appointment, and that is the case. We see people from the public, we see employees, we see patients. Anybody is allowed to make an appointment with us for a consultation or a treatment. So yeah, we are open to see anybody.
And that's a great point, and I think some of our happiest patients are those who might have loved ones here that have busy clinic schedules, and so they're in the community with not a lot to do, and they may be very stressed out because their family member is maybe ill or undergoing treatments, and it's a wonderful way to break up that waiting time and
Yes.
to come over and see us. And what's wonderful about the services that we offer, of course the spa services are very relaxing, and then things like Botox and soft tissue fillers. Botox is a treatment that typically you need every 3 months. We have patients that tend to come in every 3 to 4 months, but sometimes if they've been doing it a while, they can space that out. But some of our soft tissue fillers can last up to 1 to 2 years, and so it's great because we have these patients that may come in when they're here for their annual visits or when their loved ones are here for their annual visits. And the other thing that we love particularly about the soft tissue fillers, we love it all, but that there is an instant gratification with that because you do see the results right away. So we
Yes.
always love that, and the patients do too. And so that's something that can be a really, really nice thing. And like Heather said, open not only to employees, not only to current Mayo Clinic patients, but even if you're not a Mayo Clinic patient or you're just here visiting or community members, it's open to all. So it looks like we have some questions about how long services take. It's a really good question. So in general, it sort of depends. Now, sometimes we spend a full 60 minutes on the consultation. There can be a lot of questions, and if someone just wants to discuss what their options are, and they're really just interested in skincare and maintenance and maybe finding out what we can offer, but aren't necessarily interested in pursuing a treatment, it might be a 60-minute consultation. We do that often. Alternatively, as I mentioned, we do always try to accommodate same-day services, and so typically I would say this is definitely a ballpark, but 30 to 60 minutes for the procedures. Botox goes a little bit more quickly, but in general, I would anticipate if you are there for a consultation and a service, you'd probably be there close to an hour and a half. Versus just a consultation under 60 minutes. And if we've consulted and you're just there for a service, usually about 30 to 60 minutes for the service.
And we do like to make sure that everybody comes into their consultation and leaves with all of their questions answered. We do not want to rush anybody through a treatment. So if we feel like the consultation has taken long enough that we do not have time for a treatment, we will never rush you through a treatment. We will just schedule that for a different day. We just want to make sure that everybody feels prepared and is happy and comfortable with what they are going to be having done. But we do, as Dr. Miest mentioned, we do like to try to make sure that everybody gets a same-day service if that's what they are wanting, but we also want to do everything the appropriate way.
And I think, too, some of the main questions that we get that we spend a lot of time on, and I think it's important, are really what you can do for skincare,
Right.
as far as whether that be preventative maintenance or treatment for existing sun damage like brown spots. And so, one of the things that we go through with really all of our patients, because I think even if our patients come in and that's not what they think they need,
Yeah.
we usually get get something in there about a skincare regimen.
Yes.
And as we mentioned, we do have some skincare products at the spa that we really believe in and feel strongly about, but there are lots of different lines out there that we also recommend. And I think in general, some common questions we do get are sort of what are the basics of a good anti-aging skincare regimen? I think that comes up in nearly every visit.
That does come up in every visit.
And so what we like to tell patients is using a topical vitamin C of some sort. Now, there are a lot of different products that have, this as a component, but ultimately that's the ingredient you're looking for is a vitamin C that's going to help to protect the skin. It will supplement the sunscreen like we always talk about, and it will help to fade dark spots and really just, again, hitting at protecting the skin so that we prevent further damage down the road. And then we love to recommend retinol or topical tretinoin to our patients. That this is just so important as part of any regimen. And again, what's nice is that a lot of of our skincare recommendations, we do have over-the-counter options available. And then if needed, I can prescribe some of the prescription medications. And then I would say the other piece of that really is the sunscreen. And I think that we get a lot of questions about what to look for in a sunscreen. And ultimately, I tend not to say a particular brand because I think everyone has different preferences. And we've found that in our each other and with our patients.
And budgets as well.
And budget, absolutely. And that's super important. And I think, really the biggest thing with sunscreens are that you have a broad spectrum sunscreen. So covering UVA and UVB, and that it's SPF 30 or greater. And really, those are the main things. Those are main things. And then I think one of the things that we run into a lot too, patients don't know to be reapplying. And although it's not optimal, and there are some powdered sunscreens out there that are really nice, really trying to be reapplying every 2 to 3 hours throughout the day is huge, especially when you're trying to prevent or treat pigment issues like brown spots.
Right. And as Dr. Miest mentioned, too, with our skincare lines, we do offer a large variety of skincare lines, including an organic option. So for those that would like to have organic products, we do have that line available as well. We do like to recommend other things, too, outside of what we offer in the clinic also, because we want to respect everybody's budgets, everybody's routines. Not everybody wants to go home and use a line of 10 different products. So we like to make sure that whatever we're offering and recommending is useful to each and every patient that comes in. We will not recommend doing something that if you tell us, what your lifestyle is, we don't want to recommend something outside of that and expect you to do it and stay faithful to that skincare regimen. So we do, as Dr. Miest mentioned, with sunscreen in particular, that is something that people struggle with reapplication, even though it is so very important. It's one of those things that we can recommend a powdered option. We can try to make whatever recommendation we can to make it easier for you so that you will use it and be successful and avoid all of the things that we do see people for later on. Avoid those problems by taking good care of your skin.
And I think just to reiterate the services that we offer, and I think what sets us apart is that we are unique in that as a board certified dermatologist, I am the one doing the consultation, I am the one performing the procedures, and we provide that same Mayo Clinic level of care that people have become accustomed to. And so I think that's really important to note, that you can be sure that you are getting a safe and very high quality experience. And I feel strongly about that. That's something that you've heard me tell patients tell patients all the time. I think that these are elective procedures, but they aren't without any risk. And so I think that if anyone out there is considering these procedures, it's really important to do your research, know who is doing the procedure, know what their experience is, and hopefully have the opportunity to talk to people who have had procedures done with them, because I think that someone's reputation and someone's history speaks for itself. And I just think that sometimes with when we use the word cosmetic, it can be interpreted that this isn't a serious thing, but some
Right,
of these
that's true.
procedures are not without risk.
They
And we
all
talk
come with
about
risk.
exactly.
Yep. And we do make sure that every patient that comes
Yeah.
in the door knows all of the risks, all of the benefits. It is very, very important to know those things.
Exactly. And so that's something that I feel very strongly about, and that's why I'm so proud of what we've built here, because I think that what we're able to provide is really the highest quality aesthetic procedures in Rochester.
I agree.
I would like to think.
I agree. And it's nice because when we do get those repeat patients back and they talk about how happy they are with their treatment, we do see a lot of people, fortunately working at the Mayo Clinic, we meet a lot of people that are from out of the country, out of the state. And like Dr. Miest mentioned earlier, we do get a lot of patients that come in that we'll see once a year when they come back for their annual checkups or whatever. And they will let us know that we are the only ones that they will see. And Dr. Miest does a fabulous job with her injections. So it's really something to be proud of. We're very, very proud of that practice. So I believe there was a question. Somebody wanted to know what we had for cystic acne treatments.
Yes. So cystic acne, that really is more of a medical dermatology question. And in general, if you have cystic acne, I would recommend seeing a medical dermatologist to talk about options. Typically, when we're dealing with cystic acne, it's deep in the skin. And so topical treatments and really even some, although we have some wonderful spa services like the hydrofacial and like some of our superficial chemical peels for more mild acne, cystic acne really requires a systemic medication for treatment. So for those of you out there that were wondering, I think that really, until you treat that from the inside out, then as a second approach, come see us for some, whether or not there's scarring that we can address, or other treatments for superficial acne. But for cystic acne, that's out of the realm of what aesthetic treatments can do. Right. And it looks like we also have a question about spa treatments for men and what men can have.
Yeah, it says, what normal treatments do men receive if they come to the spa? Treatments for young male acne as well. We have men come in to the spa all the time. Typically what they will have done if they're having a skincare procedure is a Rejuvenate facial or a microdermabrasion. Both of those are amazing. They're both deep cleansing, give you a nice exfoliation. Treatments for young male acne, when I see somebody, a younger male client, and female as well, I do like to educate them on the importance of skincare. A good skincare regimen goes a really long way. And like I had mentioned before, it's one of those things that once you get in the habit of doing, it really makes a world of difference with your skin. And it's not something that we push if you are somebody who doesn't want to use a lot of different product. If you're somebody that, you come in, and I do get this all the time, we have a lot of moms that will come in and say, my teenage son won't use his products, and what do I do? And so then we kind of get to the bottom of, well, why won't he use his products? Well, maybe because previously he purchased a kit that had like 8 different steps and he was overwhelmed. So what we like to do is just narrow it down to what works for you and what will you use. And if that's one thing, if we can just get somebody started on one thing, it really is beneficial. We want to make sure that whatever you bring home is a success. We're not here to just sell product or sell services. We want to have you be very successful in whatever you're doing, and to know that if people ask you, what did you do for that? And you can say, I went to Rejuvenate, I went to aesthetic dermatology, this is what I had done. We want you to be proud of what we've done for you. So for younger male clients, I would recommend a consultation, maybe a basic facial. We do offer our hydrofacial now, which is an amazing new procedure that we have at Rejuvenate Spa. It's been very popular and it's amazing. It is a procedure. It's considered to be a hydrodermabrasion. So what it does is it deep cleanses, it refines, it exfoliates, and it hydrates. And it really helps with acne. It helps with all different types of skin conditions, fine lines and wrinkles. It's a temporary you have temporary results, but it is something that needs to be continued, but there are long-term results to it as well. It's amazing. It's just something that you would want to have done on a regular basis, whether that be once a month, once every 3 months, whatever's appropriate for your skin type. And that is something that you would determine either with myself or the other estheticians in the spa, or Dr. Miest if you come in and see her for an aesthetic dermatology consult.
Absolutely. And just to add to that, I think that really any of the services at the spa are great for both men and women.
Yes.
And so it's something that if you look at the menu of services and there's something you're interested in, I think it's totally appropriate to call and get that on the books. And we, although a lot of our patients are women, we certainly see men and can treat men, and we just, again, another really important reason to make sure that when you have these services done, that you go to someone who knows what they're doing, because men are very different, and especially from an aesthetic standpoint. So even our services, Botox, injectables, like the soft tissue fillers, that's all wonderful for men. You just approach it a little bit differently because you're going for a different end point.
Right.
And so, yes, and then just one more plug for the hydrofacial, because our patients have been loving that, and that's just a really nice and nice treatment. And like Heather mentioned, no downtime is huge, because people are busy, and so we're really loving these services that allow for that. And it looks like we have another question, and a great question about a skincare regimen for aging skin. So this is probably one of the most common questions that we get.
I think it is the most common question.
And really, I think first and foremost, no matter what you do, it doesn't matter what we recommend and what you actually put on your skin, it's sunscreen is first and foremost. Yeah. And really, not only does that help to protect, but then prevent further damage. And so I think that that's huge. So any regimen, no matter what your issue is, should include a sunscreen. And as I mentioned earlier, really the parameters that you want to stick to are the SPF 30 or above, and then the broad spectrum, meaning it covers both UVA and UVB. And I would encourage, especially for those of you who are prone to sensitive skin, making sure that you're using a sunscreen that's specifically formulated for use on the face. And then, as we mentioned earlier, I think the antioxidant, the vitamin C, is super important.
Very important.
Super important. And then a retinol or a prescription strength retinoid like tretinoin or Retin-A is one of the most common that I prescribe. Also a very important piece. And I think that those are things that, as Heather mentioned, there is an investment, and you need to use it for a while before you're going to see the results. But really, we've had just so many success stories with even the skeptics that didn't believe that a skincare regimen could do that much, and didn't think that they could reverse some of the damage that they had done. And I'd say that those are the high points of what we recommend. Now, certainly, if there are specific problems with aging skin, like brown spots, you can use things like bleaching creams. Then you can go on to things like chemical peels or lasers to treat brown spots. If there's redness involved, there are a few topical creams that help temporarily, but ultimately it's laser that's going to take care of that. And so I'd say that those are probably the high points. Now, that being said, there are some newer ingredients that we like to tell our patients about, things like growth factors, that there is some science behind these ingredients, and the data is growing behind some of these ingredients in these skincare lines that I think we've seen incredible results. And the idea is that you're putting something on the skin to potentially stimulate collagen and to help reverse those signs of aging. So I think we've covered everything. You know, a little bit about both of us, a little bit about what we offer at Rejuvenate Spa, and thank you all so much for your great questions. That's all we have time for today. Thank you so much for joining us. If we didn't get a chance to answer your question, we will try to do so after the broadcast. And if you'd like to learn more about the Rejuvenate Spa, please visit healthyliving.mayoclinic.org. Please visit us during our holiday open house on December 7th, beginning at 4:30 p.m. them. Thank you so much for joining us, and have a wonderful day.